have a 9-month-old female, pink on the tape. We found her seizing at home with no prior history. Heart rate was 155, respiratory rate 20, blood pressure 90 over palp. O2 sat was 91%, but it improved with a non-rebreather. We checked the blood glucose, which was 110. We tried an IV, but we weren't successful, so we gave midazolam 0.7 milligrams IM.
Sometimes we have a seizing child that can arrive by EMS, and that can be a little stressful when you have no notice. But in this case, we have an ETA of 5 minutes out, and we have time to prepare the room. We know that the child is 9 months, and on the length-based tape is pink. Since I have 5 minutes to prepare, I will notify the physician. I will also want to assign roles. I will need a nurse for IV access, a medication nurse, a monitor, and a recorder. All right, I will gather my length-based tape. And pink. I will have my pink card here. Okay, I'm going to grab my IV setup. So I'm going to get my IV start kit. I'm going to get a 24 and a 22 gauge needle in case we can get a bigger vein. We need to get tubes for blood, and then we can use the micro tubes to collect blood, and then IV setup. And then let's just get a Buretrol ready in case we start an IV for the baby. So now we can go to the monitor and set up for our oxygen. And you want to make sure you have the appropriate mask for this baby. So this would be appropriate for a 9-month-old baby. So I'm just going to prepare this and set it up and have it ready for the doctor. And then I'm going to set up suction. And always make sure your suction and your oxygen work. So we'll have that ready as well. And then make sure that it is ready to go. So now I will get my thermometer, so then we can check to see if our child is having a fever, because that can be a cause of a seizure. And I will have a point of care glucose ready and available in case the child is having low blood sugar, because that can be a cause of a seizure. And some of our docs will want a point of care blood gas, so I will make sure I have that readily available.
All right, Jimmy, do you want to go ahead and help me get this kiddo on oxygen? There's the blood pressure cuff. Let's get him on a monitor. That airway. Okay, just got it for you?
Yep. Perfect. Set up the oxygen, please.
Can you give me the thermometer when you get a chance to get a temperature? Hi. Hi, Dr. Sharma. We have a 9-month-old in status of epilepticus, received 0.7 milligrams of IM midazolam in the field and continues to be seizing. Vital signs are 164, pulse ox of 98% on 100% normal breather, blood pressure 94 and 57.
Okay, do we have a temperature?
I'm working on a temperature right now, and then I will get an IV.
Okay.
Let's get an IV, please. Temp is 36.8.
Thank you, Robin. While Robin's working on the IV, Jumi, can you please drop 0.1 milligram per kilo of IM midazolam?
Okay, Dr. Sharma, based on the length-based tape, the baby is 7 kilogram on pink on a length-based tape, and I'll prepare 0.7 milligrams of IM midazolam to be
That's
given.
0.7 milligrams of IM midazolam.
Yes.
Thank you.
0.7 milligrams of midazolam given IM.
Thank you. It looks like the patient is still seizing. Let's start thinking about second-line agents now. A recent study shows that 3 different medications have equal efficacy. These are fosphenytoin, levetiracetam, and valproic acid. I prefer fosphenytoin, so can we please drop 20 milligrams per kilo of this medication and get ready to give it?
Okay, sounds good.
Do you have an IV?
Yes, 22 gauge right AC.
I'll prepare the phosphate 20 milligrams per kilo.
Thank you.
Okay, Robin, here's the phosphate.
Thank you. Can I get an alcohol wipe too, please, Jimmy? Thanks.
Hi, I'm Annie's mom. I'm Nancy.
Hi, Nancy.
What's
I'm
happening?
Robin. I'm Annie's nurse.
She's shaking.
She is shaking. Has this ever happened to her before?
No, this has not ever happened.
So
Oh my
scary.
God,
So scary.
That's terrible.
Dr. Sharma's just doing a quick assessment on her, and she's going to come over.
Is she gonna be okay?
You're going to stand right here, and we're going to
Okay,
take good care of her.
okay.
Hi Nancy, I'm Dr. Sharma. I'm so sorry you're here with us today. We're taking really good care of Annie.
Thank you.
Can you tell me a little bit about what happened today?
Well, you know what? I just heard this noise, and then she was just shaking and shaking and shaking. I don't know what's happening, and oh my God, please take care of my child.
We will. Has anything like this ever happened before?
No, never.
Okay.
Dr. Sharma's starting to vomit a little bit.
Okay, let's turn her
Can you
over.
section her a little bit? Thank you. All right, her stats are coming up. She's 93%. Position her neck normal.
It appears like her seizure stopped.
Oh, looks like baby's starting to wake up, Mom. Oh, thank you. Jimmy, can you hand me a blanket? Let's get this one covered up. All right. Mama, you want to come up to the bedside? You can talk to her right here. We're just going to leave this oxygen on, okay?
Annie, it's gonna be
She can hear you.
okay.
Go ahead and talk to her.
It's okay. It's okay. You don't have to cry. It's okay. She's gonna be okay, right?
She's gonna be okay, Mom.
Okay.
We will have to transfer her to a center that has a pediatric ICU so that they can continue taking care of her.
Okay.
Okay?
Okay.
Let us
Thank
know if
very
you have any
much.
questions.
Thank you. Thank you.